the study on the behalf of Chatree Registry. The topic today is switching to warfarin after 6 months completion of anticoagulation treatment for cancer-associated thrombosis. So for the background, as you know, low molecular weight heparin is considered to be the anticoagulation for the treatment of cancer-associated thrombosis. This based on the result from CLOTS trial that investigated the dalteparin versus warfarin and found that dalteparin significantly reduced risk of recurrent VTE when compared to warfarin. So in terms of the duration of the treatment, the SWIFT-2 study investigated the patient with cancer-associated thrombosis. This study found that majority of the patient continue to receive a long-term treatment with low molecular weight heparin for more than 12 months. However, the data regarding the choice of anticoagulation remains unclear beyond the treatment after 6 months. So our objective of this study is to evaluate the efficacy and the safety of the warfarin versus the low molecular weight heparin in patients who completed initial course of 6 months of anticoagulation therapy. So this is a retrospective analysis of the patients who were enrolled in the Chatree Registry. We included the patient with cancer-associated thrombosis who were treated with low molecular weight heparin for 6 months. And the patients were divided into 2 groups, whether they continue to receive low molecular weight heparin or they switch to warfarin after 6 months of the diagnosis. The primary outcome was time to composite events of recurrent DVT and PE, and the secondary outcome were major bleeding as defined by ISTH and non-major bleeding. So for the results, from March 2011 to December 2014, there were a total of 1,502 patients who completed 6 months of anticoagulation therapy. Of these, 763 patients continue to receive low molecular weight heparin, and 739 patients switched to warfarin. A mean duration of follow-up of this study from diagnosis was 11 months. So for the main outcome of our study, we're looking at the recurrent VTE and found that 7.2% of the patients who continue to receive low molecular weight heparin had recurrent VTE, and 6% of the patients who switched to warfarin had the recurrent VTE, with the adjusted hazard ratio of 0.70, and there was no statistical significance between 2 groups. In terms of the major bleeding occurred in 2.6% in patients who continue to receive low molecular weight heparin, and 2.7% who switched to warfarin. And this is the Kaplan-Meier curves of the recurrent VTE. If you can see, there was no statistical difference between 2 groups who continue to receive low molecular weight heparin or who switched to warfarin. So in conclusion, we found that switching to warfarin did not increase risk of recurrent VTE or major bleeding after completion of 6 months of anticoagulation treatment. And however, this is based on our study may have some confounding factors, and this result need to be confirmed by a prospective study. Thank you.